Say, wanted to post a video just on my current situation with my kidneys and my health, and just how dialysis is going so far. Um, if you don't know, about 6 years ago, I was diagnosed with a rare kidney disease called minimal change disease, and what that is basically when I was diagnosed, the kidney doctor told me that it was more of a nuisance and it was never going to turn into dialysis. It was never going to turn into kidney failure. And basically, I was just going to have to control this with medications like water pills, and that there were certain medications like steroids, like prednisone, and like chemo drugs that can help with treating this and actually cure it, and well, maybe not cure, but put in remission to a lot of patients. Now, usually the younger patients respond better to the medications, um, and there's a better outcome for that. Um, Anyhow, with me, I was put on steroids, pretty high dose of prednisone, 60 milligrams, and the first time they did that was almost immediately after I was diagnosed, and I lost about 80, 85 pounds of water weight pretty quickly. I would say within, I don't know, a month and a half. So, I mean, that was really awesome. But the side effects were terrible. I mean, the normal side effects are the moon face, where your face like swells up, and but I also was getting a lot of joint pains, and then basically it stopped working when they started weaning me down. They have to taper you down from the steroid to get you off of the steroid eventually, because obviously you can't live your whole life on prednisone. It's not good for your body, um, or any steroid for that matter. So when they started tapering me down to 40 milligrams, I noticed that I wasn't losing any more water weight, and I was sort of maintaining at that time my current weight, but I just noticed sluggishness and fatigue. And then they took me down to 20 milligrams and 10 and 5, and so be it. And by the time I was done tapering, I had almost gained all that 85 pounds of water weight back. So they determined I was called steroid dependent, and basically meaning if I didn't have the steroids, I was going to swell up. So we tried another drug, which was a newer drug on the market, which was called oh my, it was a injection, and I'll think of it here in a minute. But anyhow, this injection, they sent the vials to the house, and a nurse came and taught my wife how to give me the shot in the arm, and this, I did it for 2 3 weeks, and it really didn't do anything. Um, I can't. I'm so sorry. I can't even think of the name of it right this moment. But anyways, it just didn't do anything. So um, at this point, the kidney doctor I was seeing was pounding me with medications, like blood pressure medications, and it wasn't because I had high blood pressure, because my blood pressure was fine. It was because lisinopril is shown to help with the protein in the urine that the kidney disease was causing. This kidney disease causes what's called proteinuria, and what that is you dump protein into your urine. Your kidneys um, don't put the protein that you eat into your blood. It dumps it into your urine because your kidneys are unable to hold it. So you're basically urinating a lot of the protein, and it's not getting to your body to basically get to your muscles, and um, you know you're not getting the nutrition that you need. So anyways, we were treating this with lisinopril, some other couple other medications, a bunch of water pills, and it was to the point where I couldn't even walk around without getting lightheaded, and I even passed out a few times. And thank goodness my friends were around the first time. The second time, my wife, watched me basically pass out. I came to right away, but it was still a scary experience. And I don't know what may have happened if I would have been by myself. But anyways, my first kidney doctor just didn't want to really try anything else, so I went for a second opinion to another kidney doctor. When my original kidney doctor found it, I went for a second opinion. She sent me a letter in the mail, a certified letter, saying that she was withdrawing from my care because I went for a second opinion, and 30 days to find a new kidney doctor, which I had done anyhow. New kidney doctor immediately took me off of all the medications except for the water pills. And at that point, I actually started getting better again. I dropped maybe 45 pounds of the water weight, and started to feel a little bit better with that. And then it was just a cycle up and down. I would gain the water weight, it would come off. I would gain it, it would come off. It was just a never-ending cycle. And finally, this kidney doctor said, "Okay, we're going to try something else. We're going to try cyclophosphamide. I'm sorry, is what it was called, and it's actually a chemo drug, and it's used to treat also minimal change disease, and has been successful in some patients. And anyways, he was going to try this, and he wanted to do blood work before and tuberculosis test, just to make sure, before you start any chemo drug or any pretty much big medication, the doctors want you to get these tests done. Well, my test results came back, and it showed my red blood cells were low, my white blood cells were low, my hemoglobins were low, and there was just a lot of problems with my blood work. And this was probably because I wasn't getting nutrition I needed, because first off, my diet sucked. I didn't eat the right things or, or drink the right things. And also because all the protein I was eating was basically going into my urine and wasn't helping me get nourished. So anyway, long story short with that, he wouldn't put me on any other drugs because of that. He actually sent me back to my oncologist because I had Hodgkin's lymphoma 11 years prior. So we wanted to make sure that wasn't coming back into the picture, which after another bone marrow biopsy, a bunch of blood work, all kinds of stuff, that showed up negative, thank God. So that didn't come back, but we still didn't know, and still to this day don't know why my counts are so low. I guess it's just due to this kidney disease and my body not getting the nourishment it needs. So anyways, I was hospitalized a few more times, and in October of 2017, when I was hospitalized, one of my kidney doctor's partners came in, and he said, they had talked and they wanted to see if I wanted to change to this other kidney doctor, the partner, and they said it would be like in my best interest, and because my current kidney doctor said it was above him, and he just didn't want to see me suffer anymore, and he wanted me to get another opinion and maybe try a different course. So new kidney doctor, the third one, comes into play. Anyways, we start, he really ups my water pills, my dosages. He adds another one. I was on 3 different water pills, Lasix, metalazone, and spironolactone. Those were the 3. Well, anyways, I was on very high doses of those, and then we added prednisone again. And at first, it wasn't the same result as before. It took about a month before I started losing the water weight. But then it really started coming off quick. I lost about 95, 100 pounds of water weight, and I still had a lot more to go. Um, at one point, I was up above 400 pounds because of all the swelling, and I lost about 100 pounds, got down to 300, and I still had a lot of swelling to go. So that's how bad this situation was. In February, it got to the point, February of 2018 this year, it got to the point where I could not walk anymore on my own. I was using a walker. I was having a really hard time. I was getting very weak. I was getting short of breath just walking very short distances. Um, couldn't get dressed myself. My wife was, basically serving my meals to me, and I was living in a chair. That was about it. So finally, I, said I'm pretty stubborn and hard-headed, and finally I said, Max, I apologize, my dog is barking. But I finally said, this is it. I need to do something. I got admitted to the hospital again. Um, this time, we did some IV Lasix as usual that they've done in the hospital. But then my kidney doctor had said that my kidney doctor had said that my kidneys function was very low, and at this point, I had developed also a lung infection, a very bad lung abscess that took over 80% of my right lung. So, in this case, they had to take me off the steroids pretty quickly and taper me down really quickly to get me off the steroids because it was suppressing my immune system, and we needed to treat that lung abscess. So we ended up getting me off the steroids, and I had to start on dialysis because there was really no other way to get rid of this fluid anymore. The water pills had stopped working. I couldn't have steroids or the chemo treatment due to my immune system being so low and due to this infection now. So end of February, I got my dialysis catheter, temporary one in my chest, and I start dialysis in the hospital, and they started me out really with guns blazing. I was doing 6 days of dialysis a week. I was doing 3 regular 4-hour treatments, and then every other day I would do a 2-hour treatment, which was just pulling water called oh my gosh, I can't think. Filtration, it's called ultrafiltration, is what it was called. And that when you get ultrafiltration, it's just taking the fluid out of your blood. It's not actually cleaning your blood. So, anyways, did that. Started having problems then with them taking too much fluid at once, and my heart started getting out of rhythm. I developed atrial fibrillation, which I am now being seen by a cardiologist for that. Knock on wood, it hasn't acted up lately, but it did act up twice on me in the hospital. So after dialysis treatments too. So that was definitely an issue. I had to end up going to a rehab facility a month after the hospital visit because I was unable to walk after all this. I couldn't even move in bed. I was just totally floored by it. No energy at all, no strength. All my, my muscles wasted away, and I was just basically laying in bed and not able to move by myself. So, anyways, after the rehab facility, I got out, and I was still using a power wheelchair, which I still use to this day. It's now August 28th, but I'm using that power wheelchair a lot less now. I'm starting to walk more with a walker and get stronger. I'm able to get in bed by myself now and get up and make meals. Just do some little things now. I'm able to get dressed. So I'm definitely making progress. Still on dialysis 3 days a week, Monday, Wednesday, Friday. I go outpatient to a dialysis center here local. The nurses there are great, and I ended up getting a fistula, which is which is pretty much access for. I'll try to show it here. if I can do it right. So if you see that where the stitches are in my arm, that's where it is. Basically, they just take and they revise your veins so that it makes a big vein for them to use the dialysis needles, and they use that as an access point for your dialysis instead of using a catheter in your chest. This isn't done maturing yet, as it takes quite a few weeks to grow and heal. So they're still using the catheter in my chest, but once they start using this in my arm, they said my treatments are supposed to get better and maybe even shorter. I'm up to 4.5 hours each treatment right now because they're trying to get my blood to get clean, and my creatinine levels are pretty high, which is like the waste in your blood. But currently I'm down to about 245 pounds, and I still got some fluid on me in my legs and a little bit in my abdomen, but they said I'm close to like a dry weight that I should be comfortable with, and I feel obviously a lot better with all that weight off. I mean, that's about 160-pound difference from the time I went to the hospital in February until now, which is the end of August. I mean, it's a huge difference. So I have good and bad days. Sometimes I get tired after treatment. Sometimes I get sick, but I'm just trying to do my best, trying to keep positive with it. I'm hoping to get rid of this lung infection, which I'm still on antibiotics for. And once I get done with this lung infection, they said I probably won't ever have use of my right lung again. But they said, at least, we can get the infection gone so I can get possibly on the kidney transplant list and look at a transplant here so that I can get a new kidney and, get off of dialysis and hopefully live a more normal life and, like that. So that's basically what's been going on. Sorry this is so long. Sorry I had some memory lapses. That's definitely been happening too lately. Just a lot of things going on, and there's always something going on when you're going through dialysis and treatments and stuff. So it does take a toll on you. If you're new to dialysis or new to the whole kidney disease, keep your doctor's appointments. Eat healthy. Look up kidney healthy recipes. Take care of yourself, and just enjoy life every day that you have it, because you never know what's going to happen. I mean, I had never known at 33 years old I was going to be hit with this life-changing thing where I'm working full-time. I'm just married. I got 3 dogs and a cat at home, and I just doing regular hobbies, going out to dinner with the wife. We would go out and shop, have what normal people do, and you never think twice about like, well, what happens if you can't do this? And then all of a sudden the sickness comes on and it floors me, and my life has dramatically changed, as well as my wife's, obviously. That she has stuck by me, thank goodness. She is a wonderful woman, and sure defines the whole wedding vows of through sickness and health. That she definitely does love me and care for me, and she has really helped me through this. And if it wasn't for her, I don't know if I would have been able to do this, and I'd be at the point where I am today. So, good support system and family and friends are definitely a must. Never take anybody for granted. Always, appreciate things in life, because they can definitely change. All right. Well, anyhow, I'm gonna wrap this up. Thanks for watching. I'll try to post some more updates soon, and I really appreciate all the all the messages and the supports and the thoughts and prayers. They really help, and it gets me through this. All right, have a good day.